Hello, this is outline 3. This is outline about the stomach. A stomach is the first intra-abdominal part of the digestive system. It lies between the esophagus and small intestine, first part of small intestine, this is duodenum. Its size, position, and configuration depends on the physiological state and general body build. Stomach lies or is situated in the epigastric, left hypochondriac, and small part in the umbilical region of the abdominal cavity. Also, stomach is situated in the supracolic compartment above the transverse colon and transverse mesocolon, and stomach is completely covered by the visceral peritoneum, and it is intraperitoneal organ. It has two ends, upper and which correspond to the left dome of the diaphragm, and lower end which continues with the duodenum, and these two ends are relatively fixed, and its mid portion of the stomach moves as the position of the other viscera or its content may require. Stomach is pear-shaped, and it is subdivided into the cardiac portion, then fundus, body, and pyloric portion. Also, stomach has two orifices, two opening, cardiac orifice and pyloric orifice, and then two surfaces, anterior and posterior surface, and two margins or curvature. This is the right margin, this is the lesser curvature, and left margin, this is the greater curvature. The fundus is the uppermost part of the stomach. Body is middle part. Cardiac portion or cardia surround the cardiac orifice, and pyloric portion is subdivided into the pyloric antrum and pyloric canal. Stomach has two orifices, cardiac orifice and pyloric orifice. Cardiac orifice is opening of the from the duodenum into the stomach, and area of part of the stomach which is adjacent to this orifice, which surround this orifice, is cardia or cardiac portion. Between the left margin of the esophagus and lesser curvature, there is the cardiac notch or cardiac incisor. The second orifice is the pyloric orifice. This orifice connected the stomach and duodenum. This is the opening from the stomach into the duodenum. And this orifice is surrounded by the muscular fibers which form the pyloric sphincter. This muscle closes this pyloric orifice between during the digestion. Pyloric orifice, this part is named the pylorus, and anterior surface of the pylorus crosses the pyloric vein. This is pyloric vein which crosses anterior surface, and it is very important for the surgeon to know where is the pylorus or pyloric orifice. Stomach has two borders, right border and left border. Right border it is concave. It is named. Its name is laser curvature. It has two parts, vertical descending and horizontal part. Between these two parts is angular notch or angular incisor. A plane which passes through this angular incisor divides the stomach into the body, separates body from the pyloric portion. Laser curvature is concave, and it is the place for the attachment of the laser omentum, hepatogastric ligament, and this is the hepatoduodenal ligament. And the laser curvature, two layers of the peritoneum of the laser omentum separates and covers anterior and posterior surface. Left border of the greater omentum is the left border of the stomach is greater curvature, and this is the place for the attachment of the greater omentum. Two layers of the peritoneum hangs down from this greater curvature, form the three ligaments, gastrophrenic, gastrosplenic, and gastrocolics. Two colic ligament, two layers of the gastrocolic ligament continuous in front of the course of small intestine, then ascends posterior to itself and for apron-like part of the four-layered greater peritoneum. Greater curvature is 4 to 5 times longer than the laser curvature. Laser curvature and laser omentum, greater curvature and parts of the greater omentum. Stomach has two surfaces, anterior or anterosuperior surface and posterior and posterior-inferior surface. Anterosuperior surface, this is the anterosuperior surface, is related left side, fundus and body with the diaphragm. Then with the liver, this is the left and quadrate lobe of the liver. Then spleen, it's gastric surface of the spleen. And anteriorly, this is the rectus abdominis muscle, part of the anterior abdominal wall. There are two spaces which are clinically important. This is the relations of the anterosuperior surface of the stomach with the structures which surround that stomach. First is the Labet triangle. This is area which is in contact, where is the stomach in contact with the anterior abdominal wall, and in this area the stomach can be palpable through the anterior abdominal wall. This triangle is bounded by the three planes. Horizontal plane passes through the anterior ends of the 9th or 10th costal cartilages. This is the lower part of the costal margin. Then left margin is the costal margin, left costal margin, and the right superior is liver. This is the inferior margin of the liver. And this triangle, in that triangle, stomach can be palpable through this, through the anterior abdominal wall. The second clinically important space is Traube space, semilunar space. This is space which corresponds to the upper part of the stomach. It is composed by the liver, inferior margin of the left lobe of the liver, then inferior margin of the left lung, and anterior or superior margin of the spleen. Its surface markings are the inferior costal margin, then anterior or mid-axillary line, and left costal margin. This is the Traube space, and during the percussion or percussion produce a tympanic sound over the Traube space, because beneath this space lies the stomach. Also, here we can see the Traube space, and here is Traube space. This space is clinically important in percussion of the position of the spleen, and this is the tympanic sound. Percussion produces tympanic sound, but dullness of this sound during the splenomegaly enlargement of the spleen. Posterior inferior surface is related to the many structures. These structures collectively form the bed of the stomach, lactulus of ventriculi in Latin. These are the body of pancreas, then left kidney, left suprarenal gland, then spleen, then diaphragm, and part of the transverse colon. These structures form the bed of the stomach. Between these structures, which are covered by the parietal peritoneum, and posterior inferior surface of the stomach, which covered by the visceral peritoneum, is the omental bursa. This is the lesser peritoneal sac. Wall of the stomach consists of the 4 layers. The innermost layer is the mucus. Mucus is in the contracted stomach. It is folded into the numerous folds or rugae, and most of them are longitudinal. These are the rugae, longitudinal rugae. Also, these are the rugae. Mucus has the surface epithelium, lamella propria, and muscular mucosa, and epithelium forms gastric pits, which these are the gastric pits. This is a small small pouch in the mucus, which receives gastric glands. These pits are foveoli. The second layer is submucous, and this is the layer of the loose connective tissue. Then muscular externa. Muscular externa consists of the smooth muscular fibers, and there are 3 layers of the smooth muscular fibers. Outermost is the longitudinal layer, in the middle is the circular layer, and the most internal is the oblique muscular layer. And surface is covered by the visceral peritoneum, and stomach is the intraperitoneal organ. Stomach receives blood supply from the branches of the celiac trunk. This is celiac trunk or celiac artery. Celiac trunk has 3 terminal branches. First is the left gastric artery, the second is the splenic artery, and third is the common hepatic artery. Common hepatic artery gives the hepatic artery proper for the liver, and the gastroduodenal artery. between the layers of the lesser omentum and parallel to the near the lesser curvature, there are two arteries. First is the left gastric artery, and the other one is the right gastric artery. Right gastric artery is the branch of the hepatic artery. This is the right gastric artery. Then there are the short gastric arteries. These short gastric arteries are the branches of the splenic artery. And third is the gastroepiploic artery, left and right gastroepiploic artery. These two arteries form arcade, which is parallel the greater curvature. Left gastroepiploic artery is the branch of the splenic artery, and right gastroepiploic artery is branch of gastroduodenal artery. Gastroduodenal artery is the branch of veins correspond in the position and names to the artery, except two veins. First is the prepyloric vein, which crosses the anterior surface of the pylorus, and the second one is the coronary vein. This is the vein which corresponds to the left and right gastric artery, and it is situated in between the layers of the peritoneum of the lesser omentum near the lesser curvature. And all branches are the tributary of the portal vein. This is the portal vein. Splenic artery, gastroepiploic left and right veins, then splenic vein, then hepatic vein. This is not hepatic vein, but this is the portal vein. They drain blood from the stomach. Also veins from the inferior part of the esophagus and superior part of the fundus, and veins of the cardia. They has anastomosis with the esophageal veins, and these are the portocaval anastomosis. Innervation of the stomach arises from the several sources. First, parasympathetic innervation is from the vagus nerves, right and left vagus nerves, which enter abdominal cavity like the anterior and posterior vagal trunk. These nerves or trunks give rise for the anterior and posterior surface of the stomach. Sympathetic innervation is from the celiac plexus. This is anterior vagal trunk and this is posterior vagal trunk. Then sympathetic is from the celiac plexus. Celiac plexus receive sympathetic fibers receives these fibers from the splanchnic nerves, three branched splanchnic nerves, and then from the celiac ganglia fibers like the passes around the blood vessels. This is the gastroepiploic and gastric arteries, and gives innervation, sympathetic innervation for the stomach and glands and mucus and muscles. And third source is the enteric plexus. This is the plexus, has two parts, submucosal Meissner's part, which is located in the submucus, and mesenteric plexus, which is located between the muscular muscular layers, and this is the part of the visceral neurosystem. And this is the end of this third